If you want to improve your memory, Kumbak. After doing Kumbhak, her life became so good. Within 1.5 years, she came out of insulin. Chemical medicine doesn't allow the body to recover. Doctor said, okay, this transplant has to happen, and they started Kumbhak and didn't have to go for transplant. Kumbhak is directly connected to the emotions and the mind. Sleeping pills and anxiety pills are numbing your nervous system down. Inhale, hold, and open your mouth and try to think. It becomes difficult.
Yes. So, Swamiji, in the previous session, we had discussed about what is Kumbhak, how it helps people who are going through chronic disorders, and how to, navigate through general well-being through Kumbhak and a lot of those things. So, and you spoke about a couple of times that when we pull, push, put any sort of strength, you hold your breath. So what is the role of this holding of that breath? Can you touch upon that, please?
See, life is dual in nature.
Yeah.
There are always two things. Even if you walk, you're using two legs, but then one leg has to hold the ground.
Yes.
Right. There has to be a base through which a functioning can happen. So when we say duality of life, the duality cannot function without the third pillar, which is the base on which this duality happens. Kumbhak is the base on which the duality happens. We hold the breath so that one function can happen in the body. Like if we are pulling, then that pull factor, that the strength of pulling, it has to come from a base, from something.
Yes.
The base is Kumbhak actually.
Okay.
The spine of dynamism is Kumbhak. So, like Kumbhak, breath hold, and I am saying without breath hold you cannot function. You do whatever. Without breath hold, you cannot function. Walking, jogging, yoga, Zumba, aerobics, weight exercise, climbing staircases, dancing, singing, whatever you do, there is a different proportion of breath hold which is happening with every action. But breath hold is common across every dynamic activity.
Yes.
That means this is the key for dynamism. Breath hold is the key for dynamism. Now, even if you take subtle aspects, like for example, what did you have for breakfast? Just remember, try to remember. Now, what did you have for dinner yesterday? Just try to remember. What did you have for lunch yesterday? Now, here, what did you do? You lifted your eye up, and what you didn't recognize, you held your breath. Even to remember, you hold your breath.
Yeah.
Right? So, breath hold is a factor of memory, is a base factor for memory. If you want to improve your memory, Kumbhak. I am talking simplistic breath hold. Even if you have to increase the intelligence, improve the intelligence quotient, the analytical ability, it will be breath hold. Have you focused on anything? Just try to focus on any point.
On my body?
Anywhere.
Okay.
If you try to focus on a point anywhere, the more focus you want to create, the more breath hold happens. For enhancing the focus, your breath hold is actually something which enhances your focus. If you want to improve your focus, once again Kumbhak. Right. So even if you have to improve your focus or memory or intelligence or analytical ability, if you want to see far away, what do? You hold yourself, you hold your breath.
Okay.
So, for a thought process, let's see if you can think. And do you really want that your mind gets in your control?
Yes.
Isn't it?
Mm-hmm.
So, I'll give you an example and we'll do a practical experiment to just stop the mind.
Okay.
Right?
Mm-hmm.
Now, inhale, hold, don't move your eyeballs, right? Inhale, hold, and open your mouth and try to think. Try to think. It becomes difficult.
Yes.
And you read hundreds of books for how to handle the mind, it will not get handled.
Ah.
If you do the right things only, then right things will happen.
Mm.
So if you really want to control your mind, what is the controlling factor of mind? Holding. Kumbhak. If you are not moving your eyeballs, it is also Kumbhak. If you have opened your mouth and kept it still, it is also Kumbhak. If you make yourself statue, that is also Kumbhak. If you hold your breath, that is also Kumbhak. But because the breath is the closest factor through which every other function is happening in your body and is correlated with every other function. By breath hold, we can actually handle any other function in your body. In that sense also, Kumbhak is the controlling key of any physical or mental activity.
Mm. Mm.
Beyond that, beyond those physical, mental, if we go in the subtle aspect of life, Kumbhak again is the key for controlling all those. Without Kumbhak, you cannot control anything.
Got it. So, this was amazing, huh? The thing that you told, you open your mouth and try to think now. That was an eye opener there. So, when you discovered that Kumbhak exists, like what, so you directly started working with the people with chronic disorders. That's how it happened.
Yes, that's how it happened.
Got it. Can you share a real life story of, like, if top of the head, if you have someone that you can share that they were there at A position and how they got out of that disease? If you could just share that story.
Now there are thousands of examples.
Something that stands out, maybe.
See, initially I used to do a lot of one-to-one kind of a treatment or therapy where I have done it for many, many people. There are many stories, and I'll tell you one person who was not able to speak even a single line properly.
Okay.
He was an asthma person, and there were a lot of other problems along with asthma, and he was not able to speak even a single line properly. He'll start coughing.
Yes.
And almost on the verge of bedridden condition. So he got in touch with me through a common friend, and then I went to him and I said, you can become fine, but what I say you'll have to do. He said, whatever, because I'm becoming worse. I'm completely losing my mind. I can't remember anything. I can't speak a single line. So, okay. I started teaching him Kumbhak. And at that point of time, he was taking 16 different pills. Okay. For the condition, along with the puff and nebulization and so on and so forth, many things. 3 months I continuously taught him Kumbhak every day.
Okay.
He came to one pill after 3 months.
Okay.
He was a businessman. He is a businessman.
Mm-hmm.
In a construction business, he was not able to do or be there for his business also at that time. He started looking after his business, going out, left all those pills, started speaking well, feeling well. His memory also came back.
Memory also got affected?
Also got affected. His
Okay.
memory became fine.
Mm-hmm.
So, just one example. There was a Delhi University professor of architecture who got his right side paralyzed. He said, I want to die. He got into suicidal mode, and then I said, 6 months, you just have to do it 6 months. Give me 6 months. Although it will become fine
Mm-hmm.
before, but then give me 6 months at least, become regimental for 6 months. He said anything and everything for it. He regained 92% of his sensations in the body.
Beautiful.
There are cancer people who came out of cancer when they lost hope. And one person whose bones were merging down, autoimmune disorder, and doctors said will not be able to live for long. He's still there enjoying life. And there are people whom doctors said 4 or 5 months,
Mm-hmm.
and they are healthy, living better than before. People said we are so empowered that earlier also, when we were fine, our life was not this good. After doing Kumbhak, our life became so good. A little kid, a 10-year-old girl who was taking insulin day in and day out, within 1.5 years she came out of insulin. Without insulin, she is like her diabetes is gone.
Mm.
So, any number of examples. I have many, many examples. And let me tell you some more testimonials, kind of a lab report.
Right.
There was a lady who said, a couple basically, who wanted to conceive, and doctor said chromosomal defect.
Mm-hmm.
And there is no way to correct the chromosomal defect. So she came to the program that we do, Garbhadan program, and in 6 months' time, the next report that she did was completely fine. The AMH count, anti-Mullerian hormone, cannot be increased. With Kumbhak, in 1 month's time, it gets increased. Some impossibilities coming out of insulin, regeneration of organs, the kidney issues can be recovered through Kumbhak. There are many, many autoimmune conditions where they were not supposed to survive. They are doing Kumbhak and they are surviving. The amount of recovery that happens also depends on the amount of damage which has been done to the body, the momentum of disease also. But one thing is for sure, for any kind of a condition, recovery will happen. How much time the person will take to come out of it completely is something we can't predict 100%.
Okay.
But some might take 1 month, some might take 3 months, some might take 3 years also.
This depends on what the intensity of that?
The intensity of disease and the kind of medication that the person is taking.
Okay.
Chemical medicine doesn't allow the body to recover.
Mm-hmm.
So that is why we give people a window of 1 year to come out of chemical medicine by empowering the body. Their symptom becomes fine, they don't need medication for it, and first they shift to some natural medicine, 50% natural, 50% chemical,
Mm-hmm.
then they shift to 100% natural, and then no medicine at all.
Okay.
Your body should have the strength to recover any kind of a deviation within itself. If we give the body that kind of a strength, one can come out of medication, any kind of medication. We are not designed to live on medication, any medicine, be it chemical or natural.
Got it.
Right? So, every day testimonial come to me with their lab report. Right? Even if there are some people who don't even go for a lab report. They say, we are feeling fine. And we have left the medicine and there is nothing, no problem happening. Our symptoms are gone.
Okay.
Only maximum, I'll say 5% of total people give their testimonial. There are many people who become fine.
Right.
Right?
So they come popping a lot of pills and then they go out.
Blood pressure people, their blood pressure became fine. There are unknown cause of disease. There was a person from UK who said, there is an unknown pain which just goes, moves in my body. In 1 week's time he was fine. And he said, I'm just consulting doctors, different kinds of doctors for the last 3 years. I didn't find any relief. And within a week, I'm fine. I became fine. There are such cases also. There are degenerative diseases. We do neuromusculoskeletal problem cases. We take people, old people, 75, 78-year-old couple.
Yeah.
And the lady became bedridden and there was no hope with medication. They both started doing Kumbhak and they went for trekking in Himalayas. Impossible kind of cases.
Right.
And they are so thankful. Every day I get those messages and people come to me from faraway places to meet because they say ki we had lost hope. And after doing Kumbhak, our life started again.
Beautiful.
Such cases, doctors said, okay, this transplant has to happen, and they started Kumbhak and didn't have to go for transplant, knee replacement, kidney transplant, those kind of stuff.
Right.
So all those cases are there, but one thing, there is a lot needed at this point of time to work in this area. We have to refine our modules more and more. We have to take the support of technology. We have to take the support of, we have to create mechanical equipments to actually test different aspects of life. We can actually test balas of this body also.
What is that?
The strength of this,
Yes.
different kinds of strengths of this body. Like there is a jumping strength. There is a strength of this body which where you can actually hold the ground more tight and become heavy. There is a strength of your body to digest food. There is a strength of your heart.
Yeah.
There is a strength of our body through which things flow. There is a detox strength of your body also. There are 84 different kinds of strength in your body, fundamentally, and there can be many, many branches of it. So, we have to create a lot of different kinds of diagnosis.
Yeah.
We have to work in this area of Kumbhak, and any amount of work and any amount of money put into it will not be enough to actually justify the kind of potential this Kumbhak holds.
Beautiful. So, Swamiji, we have spoken about the physical aspect of things, of how Kumbhak can help heal a person with different ailments in the physical realm of the body. I want to touch upon the mental side of things as well, because we keep hearing about this. Like, you also shared an example, like a little child, like a 22-year-old, 21-year-old, committed suicide, and it's so common, especially when you hear about students preparing for like entrance exams and this thing and that thing, quota, and we hear that 2,000, 20,000, not sure what the number is, but these are
It
the
is
number of
increasing. The
students that
suicidal
commit
rate is
suicide.
increasing.
So, how can Kumbhak, be integrated into this so that we make it reach to masses? And how is this linked with emotions and emotion management and mental health?
As I described, we have to have a definition of mind first.
Yes.
And I said the pressure ecosystem of your body is mind. Now, hormones are connected with emotions. The emotion works in correlation with the hormone flow. Hormones are stored in endocrine glands. There are sacs. And if something has to be released from the sac, your body has to create a certain pressure. Only in pressure, the hormone release happens. And only in pressure, the hormone release actually reaches to the destination. Because the flow of hormone happen in a pressure ecosystem or pressure gradient.
Right.
So pressure is related to hormone flow and it is related to emotions. So if we say psychological issue, when we say psychological issue, even if we try to see it in terms of the biochemical change within the body, the pressure and the biochemical change in the body is directly connected. What it means, Kumbhak is directly connected to the emotions and the mind. I gave you an example of how to stop the mind. Now, do you have any incidents which is very, very difficult for you even at this point to remember? Do you have any incidents in your life which is very, very painful?
Yeah.
If you keep that incidence in your mind, right, and keep your eyes open, no movement of eyes, and you inhale, hold your breath, and try to see the incidence. Imagine the incidence in your mind. Keep holding your breath and keep the incidence in your mind. Try to see it clearly. You will see it just diminishes.
Yes.
It diminishes.
Hmm.
Now, if you have to evaporate what has been bad in your life, that's how Kumbhak can be very, very effective tool. We can create modules for people who are not able to come out of a bad incident, and it just gets stuck in their mind.
Hmm.
It becomes schizophrenia with time. Even if we have to handle the mind, control the mind, and or handle the past,
Yeah.
we have to have Kumbhak in our life. Otherwise, it will not happen. Every kind of mental issues is increasing in the world. Nothing is coming down. Those pills which can numb you down are not a solution. In fact, they are doing injustice to the very process of life. You know, if you become more conscious, you can handle things. By becoming less conscious, actually you'll become weak. So those pills, sleeping pills and anxiety pills, are numbing your nervous system down, numbing your life down, which is working against the very process of life. That means they are also eliminating the chances of recovery in your life. And I'm very concerned about it. I talk it in a very intense manner. Why? Because everybody has to look at what we are doing. So, when we say stress, let's see stress. Put 10 people in the same kind of a situation. Will everybody get into stress?
No.
No. That means situation doesn't create stress. By changing the situation, if you are trying to create an ease for the person, you are not doing anything.
Yeah.
Right? That is not how solution should be looked at. By creating tolerance, the more tolerant person will be able to feel better in a very difficult situation also.
Yes.
So enhancing tolerance is required to actually eliminate stress from life. Our tolerance is Kumbhak. Right? Let's see, the students, they want to go towards whatever goal they have, they want to achieve their goal, and their goal is passing an examination or
Yes.
passing a test. It's very easy to do it. But you know, if we just create one parameter for everybody with different talent, it is injustice actually. A swimmer will swim better, a climber will climb better, but everybody, if he is tested for swimming, there are many who will fail.
Yes.
The current education system is just rubbish. First of all, and those institutions, the big institutions, IIT, IIMs, they are not doing anything. They just pull out the cream of the student population and they say, see, we have achieved so much. But if they can take the failures and make them successful, only then they are doing something.
True that.
That means in the whole education system, where is the problem? We are not, even if you have to take the test of memory, which is a passing of an examination,
Yes.
you are basically testing memory. So are you enhancing memory? There is no way in which schools are enhanced. There is no methodology for enhancing memory, but we are taking memory test, which is like ridiculous. What kind of people we have become? Trying to test a student on memory where we are not increasing the memory, because we don't know how to increase the memory, how to increase the intelligence, how to increase the analytical ability. And let me tell you, passing examination is not difficult. We are trying to create courses where we'll make them, you have to pass a particular examination test.
Mm-hmm.
You just read the examiner's mind. You will know what question the examiner will ask. You can easily pass the test.
So let's say someone is preparing for UPSC, how would you examine her?
It's very easy, actually.
Uh-huh.
Do you want to read somebody's mind?
Yeah, I would love
Should I tell you that? Should I tell you the secret?
Mm-hmm.
I'll tell you the secret. Doing is difficult. That is why I'll tell you the secret. If it would have been very easy to do, I would not have opened this up. Suppose you want to see or you want to judge the speed of another vehicle. In what state you will be able to actually pinpoint, accurately know the speed of other vehicle? What state you should be in?
Static.
Static, completely static. Mind also moves. If your mind is still, you will be able to see somebody's mind, how it is moving. It's pretty easy, not a difficult job. But practically doing is very difficult because you'll not be able to stop your mind. Right? One thing. Now the second thing. Just by what the person is speaking, you can tell what the intention is or what the tendency of that person is.
Right.
How the person will react in a situation, you can get to know. What kind of question are put in that particular examination will be able to tell you what kind of blueprint, mind blueprint is there of a particular examiner. If you are able to see. So it is just about seeing things, what the other person is throwing out. If you just observe, you know the pattern. You know what is important and what is the person trying to achieve or pull out of you.
Yes.
Right? But for that, you have to have a stable ground within yourself. Now, increasing the memory and intelligence and analytical ability, there is no other alternative. You have to do it. Passing the examination is a skill of knowing what the blueprint is. But then improving your memory, intelligence, and other aspects has to be done. Because even if you don't pass an examination and your ability to see things is better or your intelligence is better, you will be able to make your life better. A degree in the next 10 years will not be valuable. The whole ecosystem of education will crash down because this is not the right approach. The whole ecosystem of economy will crash down. The Western hegemony, the moment it goes down, the moment dollar comes down, everybody will open their eyes. Everybody's intelligence will flower. So the education system will crash in the next 10 years and only skills will value.
Yes.
So skill means improvement of intelligence. Skill means improvement of memory. Skill means improvement to be able to see things, to be able to read things, read somebody's. Skill means using this body to focusedly achieve something. How you can keep your energies in one direction. These all things can be achieved through Kumbhak only. Only Kumbhak. I'm saying only Kumbhak. If we bring in Kumbhak modules in students' life, their success rate will become multi-folds, many thousand-folds even. If we do not empower people, if we do not improve the skills of people, the innate skill I'm talking about, not reading something, innate skill of functioning, the functioning skill, to be able to function in a precise manner, that can only happen. The control key has to be brought about, you have to bring that in. Kumbhak has to be brought in to students' life.
Beautiful. Thank you so much, Swamiji, for sharing such wisdom. And this was amazing. And I need like a few minutes to just digest everything. Thank you so much.